An older adult is likely to experience a fall for many reasons. If you think of a fall as an interaction between the physical environment and certain characteristics of an individual, it's a great way to frame fall risk. Fall risk can come from the environment, the physical environment you live in, your home, for example, both the inside and the outside of the home, as well as fall risk can emanate from the characteristics of the individual themselves. And what I mean by that are things like your physical health and well-being, your overall strength and mobility, your medications, which is a significant factor. Falls can be very detrimental to an older adult, especially in terms of their quality of life and overall function. Medications can represent a significant risk factor for falls in older adults. Medications can be troublesome if they're brand new or recently changed. We know that the individual may not have a good reaction to that medication simply because it's new or have been recently increased. It can cause an increased risk of falls simply because your body is not used to that medication. In addition, certain classes or types of medications are particularly troublesome in contributing to fall. Any medication that causes you to be sleepy or groggy, any medication that lowers your blood pressure, any medication that causes changes in your gait, your ability to walk, all of these things can contribute to falls. And certainly there are many other types of medications that a nurse or a physician or a pharmacist can provide information in terms of their heightened risk of contributing to a fall. The other medication-related risk in terms of producing a fall is drug interactions. Many times as we get older, we're taking a number of different medications, and we may in fact be taking medications that no one has prescribed, but we are choosing to purchase on our own over the counter. We call those OTCs, over-the-counter medications. Why are those particularly worrisome? Because your prescriber may not be aware that you're taking those medications. So between prescribed medications from multiple different physicians or other prescribers, as well as your use of over-the-counter medications, we could have a real recipe for disaster in terms of producing a fall. So it's very important that you're aware of all of the medications you're taking. Whatever you're putting in, on, over, through, on top of, in between, any part of your body or any orifice on your body. It's very important that you share that information with your healthcare team that's working with you. And if you're not able to coordinate that kind of information, having a medication list is very important for you to keep up to date so that you can give that information to anyone who's involved in your care. BrightStar, for example, has a number of services and programs that can help you manage your medications that not only help with the simple act of managing those pills, but also will help reduce the likelihood of a fall when a registered nurse oversees that. So think about those kinds of opportunities in better reducing your risk of fall when it comes to medication management.